Hi, this is Stephanie Stock, the president of Ohio Advocates for Medical Freedom. Today we have a special guest with us, Dr. Richard Bartlett. He is a highly respected Texas emergency room physician. He was also a medical missionary, and he's globally known for pioneering the use of budesonide during the COVID-19 pandemic. Most recently, he's been on the front line of the measles outbreak in Texas. So thank you, Dr. Bartlett, for joining us and giving us some insight into how to handle the current measles situation.
Thank you for letting me join you today. This is a very important topic. We are having a measles outbreak. It's in Texas, and now it's spread to 12 other states. And so it's different than past measles outbreaks. We're seeing that the children are obviously highly contagious. This is one of the most highly contagious respiratory viruses by definition. But what we're seeing different this time is that it seems to be more virulent. We're seeing high fevers up to 106. And the risk with measles that has been understood for decades is febrile seizures, secondary bacterial pneumonia, and encephalitis, inflammation of the brain. The measles has two sources. There's the wild measles, which will come from other countries imported into the United States. That is a fact. 80% of the measles outbreak in Mexico this winter was reported to be import or import related to Mexico. So that gives you a clue that for Mexico, 80% of their cases came from other countries, and they were able to document that with their health department. So it comes from other countries. Securing the border is the most important preventive measure that public health can do. So President Trump and RFK Jr. and the cabinet staff deserve kudos for saving lives and preventing infectious disease outbreaks of every kind, including tuberculosis, which doesn't require a vaccine. We have no vaccine for tuberculosis, but that has also exploded in the United States over the last 3 years. And that's not vaccine related or unvaccine related. So that said, what do we do right now if you're a parent? Know that this is not a game. This is actually a very serious disease. It's not something you want to sit on at home. You have to be proactive and know that the rash is one thing, but the rash is not the thing to focus on. It can be sensational. It's unique. It's called a morbilliform rash. But the danger is 1 in 20 children historically will end up with a secondary bacterial pneumonia. And we know that the number one risk factor for bacterial pneumonia is a primary viral respiratory infection. That's what COVID was. That's what COVID is. That's what influenza is, the flu, and that's what measles is. They are primary viral respiratory infections. So a person is at increased risk of bacterial pneumonia, 1 in 20 historically. What we're seeing is that might actually be a higher rate with this particular outbreak, meaning that this measles outbreak seems to be more virulent, meaning more dangerous. And so what are we seeing? The 106 fever, sometimes febrile seizures. You can't have a febrile seizure with your child if you control the fever. And so you can control the fever by multiple ways, whether you use Tylenol, Motrin, some herbal remedy, lukewarm baths, not cold baths, because that actually will shunt the blood away from the skin and will make it harder to lower the temperature. But you have to do fluid hydration, and you have to control the temperature. Another thing that happens with measles sometimes, and in this outbreak, is dehydration, decreased appetite. They're drinking less. The fever itself can cause dehydration, but beyond that, they're having some are having diarrhea, vomiting, stomach bloating, decreased appetite, and that contributes to the dehydration. So you have to be very alert to that and make sure your children are getting their fluids. If they have a fever, if they develop the rash, the concern is after measles, whether they're going to get a secondary bacterial infection or encephalitis. Both of those are risks, by the way, with the vaccine, which is a live measles virus as well. So people need to know there are risks with the vaccine. Those are listed on the package insert, which is online. I recommend everybody look at that. But concerning the outbreak right now, which largely is a wild measles strain, which we know is imported from other countries every year. And that's what Canada, the government of Canada, has found in their measles outbreak happening right now. In Europe, there's a measles outbreak, which is not in our news, but they have a bigger problem in Europe than we do in the United States. And so we want to do fever control. You have to, so you don't get a febrile seizure. And you got to treat dehydration, and you need to be very aggressive at stopping vomiting and diarrhea. There are treatment measures for that. And then you need to take care of the respiratory inflammation that measles can cause. And so we saw that with COVID. Inflammation of the airways makes it harder for the immune system to fight secondary bacterial infection and to recover, and it sets you up for the secondary pneumonia. So an inhaled steroid called budesonide can be given as a nebulizer treatment to children. This is a medicine that's been used on children as little as 2 pounds in the premature ICU, in the pediatric ICU. Premature babies that are 2 pounds have used this over 30 years now. And that's as delicate a human as there is. So if it's safe for them, it's safe for your child. And again, there's indications and contraindications that you can look up on the internet for every medicine. This is over the counter as a nose spray, but the nebulizer treatment requires a prescription. It'll decrease the inflammation. How does it do that? It decreases mucus production, which is important. And it also decreases the release of the cytokines, inflammatory chemicals that are released from the respiratory lining that cause all of the symptoms, the fever, the chills, the cough, the shortness of breath, the vomiting, the diarrhea, all originate from cytokines released, mainly from the respiratory lining where the infection is. And so using the budesonide has been shown to shut down the release of cytokines from the respiratory lining during the nebulizer treatment, which will take 5 minutes to do a nebulizer treatment. And so every time a child gets a nebulizer treatment, their cytokine release, the inflammatory chemical release, is shut down to zero. And so that's a very powerful tool. The second thing to be alert to, see your primary care doctor, go to an urgent care if needed, go to the emergency room if needed, but not everyone needs to go to the emergency room. Not everybody needs to go to the urgent care. But if they have a fever, a productive cough, they have shortness of breath, then the budesonide nebulizer treatments are a tool to decrease inflammation in the airways, which are helping many right now during this outbreak. And if a doctor sees the patient and says that an antibiotic is appropriate, this is a time where we know that it is more likely to be appropriate than not. With antibiotic use, we try to be good stewards. Doctors are required to be very careful not to use antibiotics inappropriately. But there are times that it is appropriate to be proactive. And this is one of those times. 1 in 5 children may need to be hospitalized with measles outbreaks. That's a very significant number. And so the goal is to decrease your risk of going in the hospital, your risk of having bacterial pneumonia. So antibiotics are a useful tool empirically and also prophylactically. Prophylactic means we know someone's at increased risk. For instance, if someone's going to have a knee replacement surgery, they don't have an infection, but they're going to get IV antibiotics in the United States every time before they have surgery because they're at increased risk of an infection afterwards. And so that's called prophylactic antibiotic use. Empiric use is we know someone has an early infection. We have all the evidence that they have an early infection. They have a productive cough. They have shortness of breath. They either have bronchitis or pneumonia, bronchopneumonia, pneumonitis. If they have a bacterial infection, they need the antibiotics. And so that's being proactive, treating early before you have a definitive diagnosis is empiric treatment. The antibiotics I recommend are either IV azithromycin and cephalosporin or penicillin. The reason azithromycin IV is a good idea is it covers Mycoplasma pneumonia, a common cause of atypical pneumonia or walking pneumonia. This is common without measles. Actually, famous actors and entertainers have died of walking pneumonia in the last decades, uh, be, which is treatable with IV azithromycin or even oral Z-Pak or an oral clarithromycin, which is generic Biaxin. Those medicines will cover that. They'll also, so I choose a clip, I use clarithromycin because that covers the walking pneumonia, mycoplasma pneumonia, Legionella pneumonia, which causes Legionnaire's disease, and chlamydia pneumonia, which are not covered by penicillins and cephalosporins. And it also covers the strep pneumonia, which is the encapsulated classic bacterial pneumonia. So it covers everything. So my goal outpatient is I usually use clarithromycin. I recommend that. And there are some other tools that also will kill viruses on contact. The virus starts for 3 to 5 days in the nose and throat and eyes is how it enters the body. And it'll multiply for 3 to 5 days in the nose and the throat. That's called a prodrome period, where you don't have a lot of symptoms. The virus is multiplying exponentially. You have the virus going into cells, multiplying, and then releasing more new virus onto the respiratory lining, and that's happening cyclically and exponentially. And if you use a betadine or an iodine nose spray, throat spray called Immune Mist from immunemist.com, that will kill any virus that it is in contact with on contact. And so that's from, I use that. It's called Immune Mist from immunemist.com. Another tool is mouthwash. In 2020, during the COVID outbreak, the University of Cardiff in the UK showed that mouthwash kills COVID virus in 30 seconds on contact. If it kills COVID at the beginning of COVID when it was deadly in 30 seconds on contact, it will kill measles virus and any other virus as well. Now, mouthwash works in the mouth and throat. It won't get to the nose, the nasopharynx and sinuses, but every tool is being mentioned that's a useful tool, and mouthwash is a useful tool. You can use that fairly frequently if you're having symptoms of a respiratory infection. What are the
Dr.
symptoms?
Bartlett, would you recommend that if you have a child with measles or COVID or anything, actually, would you recommend that the other family members go the route of the mouthwash and maybe the nasal spray just to help increase their chances of not getting it?
Yes. So family members can use mouthwash. They can use iodine nose spray, throat spray, and those are excellent preventive measures. Of course, everybody's talked about the vaccine, so people need to read the package insert and decide what they're going to do with that. But yes, the strategies that I believe are scientifically backed are mouthwash by the University of Cardiff against viruses, and budesonide nose spray was a game changer. It's over the counter during COVID. It does interfere with the attachment of COVID to the respiratory lining by ACE receptors. Measles is a different mechanism, but it does stabilize. Budesonide is a corticosteroid. It will stabilize the cell membrane, block the release of inflammatory cytokines from which can cause congestion, a cough, headache, sore throat, and it'll also make it harder for a virus to multiply. So budesonide nose spray is also another useful tool. And so there are things you can do early, and supplemental oxygen is being used. And so if a patient has access, their doctor will prescribe supplemental oxygen. That can get many people through without being hospitalized. But if in doubt, go to the hospital, go to the ER, go to the urgent care, go to see your primary care doctor if you have symptoms. And so we're not helpless, we're not hopeless. Measles cases are in the United States every year. We had a larger outbreak in 2019. We had a large outbreak in 2016. We know that it's imported. We know that President Trump and his cabinet and RFK have done a tremendous service to the American people with the public health measure of blocking illegal immigration of millions of people unvetted, which has increased infectious diseases in the United States this winter of tuberculosis, which is not preventable with vaccines, and other infectious diseases, including measles. So we owe them a debt of gratitude for doing that. That's very critical.
Sure.
So measles can be treated, and the measles itself with the virus is not the immediate threat. It's the sequelae, it's the complications which could come after the fact that are not measles of a bacterial pneumonia that need to be managed and can be treated.
So that's really amazing information, very helpful. As far as it being a parent, say you, okay, my gosh, I see the rash, like my kid is like, I definitely know they have measles. Do I just go ahead and make an appointment and say, hey, look, this is where we're at? Maybe say, maybe even show your primary doctor this video. Maybe they don't know. I mean, that's one of the issues we're seeing is that physicians across the country have kind of depended on vaccination to keep these things away, right? But this is a problem because when they need to be treated, physicians need to know how to treat their patients, because at the end of the day, that's how you get through. Like, that's how we get through anything that we didn't have a vaccine for before, and that's how we'll get through everything else in the future. So to that mom that say, okay, well, I'm not really seeing anything severe right now, I'm just seeing the rash, should I go ahead and take them in, let them know what's going on, and then maybe as a backup say, hey, should we grab a Z-Pack today? Should we, can I get a prescription for budesonide? If I wake up in the middle of the night, my kid starts coughing and having some issues in the middle of the night, it's not severe, but should I do that? And then at what point do you say, you know what, this is an urgent care visit?
This is an excellent question. You have to have a thermometer in the house. You have to monitor the temperature and do fever control. That's very important for the safety of the child. The second thing is a simple device that you can buy over the counter at any pharmacy is called a pulse oximeter. And every family that's dealing with a respiratory infection should have that in their house. A simple device you put on the finger, it'll tell the oxygen saturation level. Normally in an ER before COVID, if someone's oxygen saturation was below 90%, they would be hospitalized. But during COVID, we've seen that that's really changed our paradigm on that. And so we've seen people many times with lower in the 80s that might not be admitted to the hospital. But if a child has an oxygen saturation on room air that is below 90, they absolutely need to be seen and seen quickly. And if that's, as far as vital signs, that's most critical. We talk about pulse and blood pressure and respiratory rate. If you see your child's panting, has retractions because they're having such difficulty breathing, they need to be seen for their safety. But yes, proactive early treatment saves lives. We learned that with COVID, with any disease. And if you're dealing with a bacterial pneumonia, early treatment is better than late treatment. And if you're at risk of secondary bacterial pneumonia with an unusual circumstance like a recent measles outbreak, and now you have fever, productive cough, some shortness of breath, maybe the pulse oximeter reading is dropping, then you need to be treated immediately early is the best plan. And so to say we're going to ride this out at home is a bad idea. This disease seems to be more virulent than the historical measles that we've dealt with in the past. And so something that people would do with other infectious diseases like chickenpox is have a chickenpox party historically, where they'd have all the neighbors would come in the 50s and 60s. They'd come over and they'd all get exposed and they'd all get the immunity to chickenpox. You do not want to do a measles party with this. This is not a game. This is very serious, and it requires 24/7 diligence by the parents to watch the temperature and control that. And also
speaking of temperature, because a lot of us we've been holistic for a long time, and we know that fevers do have a purpose. But what would be the breaking point? Like, once you get up, if you get 104 is what we've always heard. Like, once you get to 104, you really should start handling at that point. What do you think is the magic number fever wise for measles, or is there one?
So it's an excellent question. It depends on the individual. Everyone needs to be treated as an individual. A holistic pattern that is just said for everybody is wrong. A medical pattern that's for everyone is wrong. That's communist medicine. That's socialist medicine. That's bad. Some people have seizure disorders. And also your seizure threshold, your chance of getting seizures increases as a child is younger. So a newborn can get a seizure at a lower temperature than a 1-year-old. And a 1-year-old can get a febrile seizure easier than a 2-year-old. And so many factors need to be uh, considered, I would say if someone has a temperature over 101, 101 or more, with this particular outbreak, you need to be treating it. And there have been parents who have been treating their child with Tylenol, and they still have 106 fever despite the Tylenol. And so Tylenol is more effective at lowering the fever than herbal supplements and holistic medicine as
Right.
far
And
as
what would
lowering
be
the
good
temperature.
if we do have we have a lot of families in the autism community that have concerns about the glutathione issue. What would you recommend as an alternative to Tylenol? What would be the next best fever reducer that might not have such a great effect on that for those families that that have issues with the glutathione already with children that are affected? I mean, we hope they aren't going to have to suffer through that, but if they do, what would you suggest for fever reducers in that case?
So in the emergency room, we rely on Tylenol, ibuprofen, also lowers temperature. Lukewarm baths is another tool that will lower the temperature. In the medical setting, we can give IV fluids, and IV fluids can lower the temperature. And so there are herbs that will holistic measures that will lower temperature. However you want to do it, you have to keep them from having a high fever. And what is a high fever is an individual issue. Some children can have a febrile seizure at 102.
Mhm.
Some children will have a fever of 106 and not have a febrile seizure. Everyone is an individual, even in the same family. And so um, the key, compared to other respiratory infections and other illnesses, it seems to be a heightened risk with the measles outbreak right now. So diligence at lowering the temperature, however you want to do it, is the key. Early treatment saves lives. If you see the fever, having a high fever is not going to give you a better lifelong immunity from measles than if you didn't get a high fever. That's a myth. That's a fantasy. That's a fable. And so if you have been exposed to measles, live measles infection with the wild measles, you have lifelong immunity and you don't need to have a risk of febrile seizures with your child. And so fever control, and it's really critical to do something uh, about the fluids and preventing dehydration. So if someone has vomiting or diarrhea, there are tools for that. There are herbal things for diarrhea and for fever. But in my world, I'm a medical doctor, work in the emergency room. So we use a tool called Zofran. And so that's for decreasing nausea.
We've seen in the WHO, of course, vitamin A can be depleted during measles. We do know that. But the most of the deaths we see are in third world countries, right? Because they're nutritional, the deficient nutrition, etc. Do you see vitamin A as a big life saving thing for United States, or is it really just the management of the disease itself, getting through it, and vitamin A would play a much more minor role here in the States? What's your thoughts on that?
So the vitamin A studies were showing most effect in countries that were third world countries where there is vitamin deficiencies and nutritional deficiencies. In Texas, we don't see that. I do medical missions around the world. I have seen the signs and symptoms of clear vitamin deficiencies. You know what deficiencies they have when you see them, whether it's their rash or their bone deformities. And so we're not in that picture here. Vitamin A supplementation could be done, but it's not a primary benefit right now during this measles outbreak. Unfortunately, it's not going to carry you as far. Fortunately, we have better nutrition and we don't have the vitamin deficiencies that I see in third world countries. It's actually the World Health Organization that really promoted the vitamin A multiple doses to treat measles because they're looking at third world countries, which is a different picture than you'll have in the United States.
Thank you, Dr. Bartlett, for your amazing insight on this, your heart for patients, your common sense, innovative approach to patient care. You've been amazing all through COVID and now, and you've been really an asset to everybody that you come in contact with, just a real gem. So we appreciate you so much. For people that want more information about Dr. Bartlett or the effectiveness of the budesonide treatments themselves, please go to budesonideworks.com. And if you would like to financially support or volunteer with Ohio Advocates for Medical Freedom, or learn about our medical freedom legislation and how you can help us get that passed, please visit us at ohioamf.org. Thank you so much for watching.